Almost everyone does it. You reach for the nearest redness-relief bottle the moment your eyes start to itch. But here's the brutal truth. The wrong drops can actually make things worse. Itchy eyes usually come from two completely different problems, either allergies or dryness. And the right fix depends entirely on knowing which one you really have. So in this video, you'll learn how to stop the itching fast, how to help tell allergy from dry eye, and how to keep it from coming back again. And I think the best way to do this is by understanding what's actually happening inside your eyes when they start to itch. When your eyes react to something you're allergic to, like pollen, dust, or pet dander, your immune system treats it as an intruder. The surface of your eye, called the conjunctiva, releases histamine. Histamine makes blood vessels dilate, tissues swell, and tears overflow. And that's what we call allergic conjunctivitis. It's classic for eyes that are red, watery, and usually itchy. Your eyelids also may become puffy, and itching tends to get worse when you step outdoors or you're near your pet. Now, let's contrast that with dry eye. Here, the problem isn't histamine, it's poor lubrication. The tear film that normally keeps your eyes smooth and protected either evaporates too fast or doesn't form properly. Without that stability, though, tiny nerves on the corneal surface get exposed to air and trigger burning, irritation, and occasionally a mild itch. So many dry eye sufferers describe their eyes as gritty, sandy, or if there's something that's constantly in them. And unlike allergy symptoms that flare up and then calm down, dry eye symptoms tend to linger every single day. And here is the tricky part. They both can look the same in the mirror: red, irritated, and watery. And that's why people often misdiagnose themselves. But there are some simple clues that can help you. Allergies usually show up fast, often seasonally, especially in the spring or fall, and the tearing is excessive because your eyes are trying to wash away the irritant. Dry eye, on the other hand, feels worse after doing activities like reading, computer work, or any task where you don't blink enough. And instead of causing constant watering, dryness may cause reflex tearing that briefly helps but doesn't last. Environmental triggers tell another part of the story. Allergies thrive on pollen bursts, pet dander, and household dust, where dry eye thrives on low humidity, smoky air, or heavily air-conditioned rooms or environments. And age and certain medications can also worsen this too, and they play a role. And there's an overlap. A person can actually have both, but the root cause is completely different. And you want to think of allergy as an overreaction, while dry eye is an under-lubrication problem. And here's a quick self-check. If your eyes itch and water like crazy, you might want to think more allergy, but if they feel burny, gritty, or blur late in the day, you want to think more dryness. And ask yourself one question before grabbing drops. Are your eyes watering or burning? That answer may tell you which solution may actually help you. And once you figure that out, let's talk about now how to calm them down quickly. Now that you've figured out whether the problem is more allergy or dryness, let's get you comfortable quickly. Goal here is not to mask symptoms, but stop the cycle of itchiness, redness, and irritation within minutes, and to do it safely. If your eyes itch like crazy, you're most likely dealing with an allergic response. The best drop for this are ones that fall into a special group called antihistamines and mast-cell stabilizer combinations. These drops work in two ways. The antihistamine part turns off the histamine reaction that's making your eyes itch and swell. The mast-cell stabilizer part stops your eyes from releasing more histamine later, preventing another flare-up. And that's why formulas like ketotifen and olopatadine have become the most recommended over-the-counter choices. And you'll find ketotifen in brands such as Zatador and Alway. Both give relief up to 12 hours. Olopatadine, found in Pataday, can control itching for a full day with just one drop per eye. These medications kick in quickly, often within 15 minutes to 20 minutes. If you catch your allergy early in the day and use one of them before heading outdoors, you can often avoid a full-blown episode altogether. And this is what I tell patients all the time. Don't wait until your eyes are already swollen. Use these medications early when you first start to feel the telltale signs of itching and burning. And some of you might still be tempted by drops that promise to get the red out. These drops usually contain decongestants, and these medications typically shrink blood vessels on the surface of the eye, so the redness seems to vanish within minutes. The problem, though, is that your eye can get used to that constriction. And over time, blood vessels rebound, meaning when the drop wears off, your eyes can look redder than before. And that's what we call rebound redness. And it actually can become chronic if you use the drop too often. So, can these drops be used? Yes, but use them sparingly, meaning once in a while for a special event, but never every day. If you have sensitive eyes or use multiple drops throughout the day, always look for preservative-free versions. Some preservatives, particularly BAK, can irritate the eye surface and worsen dryness or allergies. Single-use vials or some of the modern multi-dose preservative-free bottles are your safest bet for long-term use. So now let's talk about what to do if your itch isn't allergy-driven but dryness-based. And in this case, antihistamines won't help because there's no histamine to block. Your solution here is lubrication, the right artificial tears for your specific dry eye type. So basic artificial tears made with polyethylene glycol, propylene glycol, or carboxymethylcellulose can soothe mild cases by replacing the watery layer of your tears. For more severe or evaporative forms of dryness, try lipid-based tears. These restore the oily layer that prevents tears from evaporating so fast. Brands like Sustain Complete and similar lipid-enhanced formulas work well if you're constantly in dry, windy, or air-conditioned environments. If your eyes sting, burn, and blur the longer your day goes on, pick a tear with hyaluronic acid, a natural water-binding molecule that holds moisture on the surface longer. And for chronic cases that just never quit, newer agents, like found in the medication Mibo, form a protective barrier mimicking your eye's own lipid layer. It dramatically reduces evaporation and is especially useful when environmental dryness flares during allergy season. Pair that with a warm compress at night to help unclog the oil glands along your eyelids, and you should be all set. And while we're on compresses, remember this rule: cold for allergy, warm for dryness. A cold compress constricts blood vessels and soothes swollen, itchy tissues, perfect after mowing the lawn or walking the dog in the spring. A warm compress, on the other hand, melts blockages in the oil glands and increases tear stability. Ideal if you wake up with irritation or have dry eyes from long hours on screens. And for both conditions, a sterile saline rinse can help wash away allergens, debris, or leftover eye drop residue. Use sterile saline, not tap water, because tap water can contain bacteria that don't belong near your cornea. And when your allergic itch flares up, here's the exact step-by-step relief plan. First, remove your contact lenses. Contacts can trap allergens against the eye surface. Rinse your eyes gently with sterile saline or preservative-free artificial tears. Physically flush out pollen and dust. Next, apply cold, clean cloth over your closed eyes for about 5 minutes. And finally, apply your antihistamine drops. Do not rub your eyes, even though the temptation is there. Rubbing releases more histamine and breaks tiny blood vessels, leading to more swelling and redness. And most people feel clear relief within 20 to 30 minutes if it's an allergic reaction. Dry eye, however, takes consistency rather than speed. You'll need to use lubricating drops several times a day and pair them with environmental changes like running a humidifier or limiting direct airflow to your face to see true improvement after several days. And here's what many people get wrong. They keep adding more of whatever drops seem to help a little instead of identifying which type they actually needed. Overusing redness drops can actually make the eyes weaker and more dependent on them. On the other hand, underusing lubricants for dry eye means your eye surface never gets a chance to fully heal. So everything comes down to choosing the right category and using it correctly. And if you're not sure whether your irritation is pure allergy or part dryness, you can safely combine short-term antihistamine drops with preservative-free lubricants. Apply the allergy drop first, wait 15 minutes, then use the tear substitute. That sequence gives you both immediate comfort and surface protection without interference. So at this point, your eyes should already feel calmer, should fade within a half an hour, and dryness should start improving within a few days of consistent care. So the next question now is how to keep things that way, which separates temporary relief from real prevention. So before you reach for another bottle, let's look at what actually keeps these symptoms from coming back. Here's the blunt truth. Quick relief means little if the itching comes back every time the wind changes. Allergies tend to flare with the seasons, while dry eye is usually a long game problem. So prevention needs to match the cause. For allergy-prone eyes, think strategy not reaction. Start using mast-cell stabilizer drops, those same antihistamine stabilizer combos like ketotifen or olopatadine, before allergy season begins. They quietly block histamine release, so when pollen hits, your eyes barely react. It's like putting out the match before there's smoke. Keep your surroundings clean and allergen friendly. Change pillowcases weekly in hot water. Use HEPA filters in your bedroom and run them continuously during pollen peaks. If your pet sleeps near you, that fur carries dander straight to your eyelids, so train them off the bed or at least clean bedding daily during flare seasons. Also, when you come inside from gardening or walking, wash your face and eyelids with mild baby shampoo or dedicated lid wipes. That simple rinse removes pollen that would otherwise sit on your lashes and keep the immune system irritated all night. Limit outdoor exposure at midday when pollen counts spike, and check the daily pollen index just like you check the weather. Sunglasses actually matter here. Wraparound pairs block airborne allergens and shield your eyes from wind and dust. And if you must be outside on a smoky or dusty day, protective glasses can make the difference between a quiet evening and another itch-filled night. For dry eye, the routine looks different. It's not about fleeing allergens, it's about preserving moisture. So, you want to build a morning and evening eyelid care routine. Apply a warm compress for 5 to 10 minutes and gently massage along the lash line to keep your meibomian glands flowing. Follow this with preservative-free tears or a lipid-based drop if you're battling evaporative dryness. During work hours, remember the 20-20-20 rule. Every 20 minutes, look 20 feet away for 20 seconds to rest your blink. And reduced blinking is one of the fastest ways to dry out the ocular surface. And as we talk about the ocular surface, we must mention that nutrition plays a quieter but important role. Omega-3 fatty acids found in fish oil or flaxseed support tear film quality by improving oil gland function. And many patients see less burning and fewer blurry episodes after consistent intake for several weeks. And if supplements aren't your style, eat salmon, tuna, or chia regularly. Technology is catching up too. Lipid-based tears mimic the natural oil layer, and newer therapies being studied work by gently stimulating the tear reflex. So, for stubborn inflammation or gland blockage, in-office therapies like intense pulse light therapy or LipiFlow can help restore drainage and reduce the flare-ups. But they're not first-line treatments, but they are worth discussing if home care no longer controls your symptoms. And I need to say this, don't tough it out if the itch doesn't improve after a few days of using correct drops, or if you notice swelling, pain, or vision changes. These are all red flags needing real medical attention. The answer here is you want to see your eye doctor for an examination of your eyes, which will help diagnose and treat these conditions correctly. It's easier to correct the problem before it turns chronic. So some people also lean on natural or supportive methods. Sterile saline rinses help flush away irritants, and cold compresses reduce surface inflammation quickly. There's also information and studies about probiotics that may help regulate immune reactions, and a balanced diet rich in antioxidants does support ocular surface healing. These can complement medical treatment, but they shouldn't replace a good eye exam with your eye doctor for the proper diagnosis, along with proven drops when symptoms are moderate or worse. And finally, let's talk about environment. Air pollution has become a serious in eye irritation. On smoky or high pollen days, stay indoors with windows closed and use an air purifier if you have one. Exhaust fumes, wildfire smoke, and even house dust can destabilize your tear film and spike inflammation. Urban residents often notice flare-ups just from walking on a busy street or during heat waves. Controlling exposure is really half the victory. And here's the strategy. Treat allergic eyes early every season before symptoms explode, and nurture dry eyes constantly year-round. Prevention may sound boring, but consistency saves you from another round of burning and scratchy morning. Identify your triggers, stay ahead of it, and your eyes will quietly thank you all year round. Now that you know both how to relieve and how to prevent, let's wrap things up together. If your eyes itch, don't guess. Know whether it's allergy or dryness, because the right answer changes everything. Antihistamine and mast-cell stabilizer drops like ketotifen and olopatadine stop the allergic itch fast and guard against future flares. Lubricating and lipid-based artificial tears help rebuild comfort for dry eyes that simply lack protection. And here's what really matters. Redness drops are not your friend. They mask irritation, but make it worse later through rebound redness. Always read the label. If it lists a decongestant medication, use it sparingly. only. And if pain, swelling, any vision changes appear, that's your clue to call your doctor, not another trip to the pharmacy. And the blunt truth is, early identification is the simplest and safest path to lasting relief. So call your eye doctor to get in there, get seen, and figure out what's going on. Because your eye doctor will help you figure out what's really causing your itch, match the right drop, and help protect you from your environment, which may trigger. And your eye doctor will help you figure out what's really causing your itch and help match you to the right drop and preventive measures. Your eyes deserve the precision and care every single day. Please give this video a thumbs up if you found it helpful and share it with anyone constantly rubbing their eyes during allergy season. Hit the subscribe button. Not only will you join a growing community that values straight, evidence-based eye care, but you'll also be the first to know when new guidance drops. And for those of you who want deeper insight into the best allergy eye drops on the market, take a look at the link below in the description. Your eyes will thank you for it. See you next time.